colleague, Dr. Lapointe, to address some comments from your experience.
Yes, I think I may jump here at the right moment because in Canada our laws have also been interpreted based on UK jurisprudence. So so although our law is our patent law is quite similar to the US law, it has always been interpreted based on the UK decision. So we don't have a doctrine of equivalence in Canada either. However, we are the claim constructions is called what we call purposive constructions, and this concept was based on a UK decision many years ago. So for having the purposive construction, so first you have to identify what is the person's skilled in the art, and consider what are the essential elements in the claims. And according to that constructions, unless an element is clearly, so there is some rooms in terms of, it's not a literal interpretation per se, so there is some literal meaning there that can be, some words that can be changed, but it has to be clear from reading the specification that the patentee wanted such element not to be non-essential. So if there is a slight variation is permitted, or whether there is a strict adherence. So if it was claimed from the specification that the strict adherence was important, then the claim is limited. So and you are not allowed in Canada to have extrinsic evidence to construct. To solve these kinds of issues and list a new compound, so a new chemical entity, a new formulation or a new combination of ingredients having the new chemical entity, a new dosage form, and as well a new use. So it's all be possible to register on the patent register. And in the past, the regime, so if a generic wanted to enter the market, and then they could, and that would be blocked by the patentee, of course, based on the register, if they were claiming, well, the patent is invalid or non-infringed, and there would be a litigation just for that particular, those two companies. And if the generic would win, then it will be automatically, they will obtain the commercialization approval from the Minister of Health and go to the market. And then it would be possible again for the patentee to sue because they were now commercializing the product, and the patent would not have been declared invalid or infringed on its value per se. So, but that all changed 2 years ago. So now there's a completely different litigation regime in Canada, and now it's a bit more aligned like in the US, where if there is a challenge based on the patent register, then it's a full litigation where the court will decide whether the patent is valid or infringed or not. And now also the patentee will have the right to appeal, which was not the case.